Hi, this is Dr. Payal Biswasu, consultant physiotherapist and a faculty in diabetes in pregnancy, certification of competency. So we are teaching the nurses and other staffs the exercise during gestational diabetes, so that they are the person who will be coming in contact with the patients, and they will be monitoring the patients whether they are doing the physical exercises, walking or not, to maintain the sugar level. And if this nurses and other paramedical staffs, if we teach them, they will reach the mass, and we will have a better control on sugar level for the GDM patients. Thank you.
Hello, this is Sheetal Joshi. I am a dietitian and a nutritionist at Divakars Speciality Hospital, and also a faculty for diabetes in pregnancy certification course. Today I am going to tell you why nursing staffs are important to have these trainings. The nutrition has been, science of nutrition has been changing from generations, and now it is more important. And we are seeing that nursing staffs are not adequately trained to recommend the lifestyle changes, which is very important to manage diabetes in pregnancy. Nursing staff can be a promising strategy for us to manage the pregnancy, diabetes in pregnancy, as they can do one-to-one counseling to the patients, and they can make the woman very confident in managing her diabetes. Training the nursing staff on the carbohydrate counting, the food groups, what are supposed to be eaten, the glycemic index, will help them counsel the patients. It will help them to tell them that high carbohydrate foods like juices or bakery products or the candies are not healthy for them. So it will help the nursing staff to promote good food, healthy food to the patients. You see that in pregnancy there are lots of physical and emotional changes. That's why the nursing staff have to motivate them, tell them, they cannot tell them too much restriction of food. They can just tell them that you avoid certain unhealthy food and start with the healthy food. This will help the woman to fight diabetes. Thank you.
Namaskar, this is Dr. Hema Divakar, consultant obstetrician at the Divakars Speciality Hospital. I am also the CEO of ARTIST, which expands as Asian Research and Training Institute for Skill Transfer. We are very happy today that ARTIST has collaborated with the Bengaluru Society of Obstetrics and Gynecology, thanks to the President, Dr. Chandrika Muralidhar, who has supported the very first of its kind course for skill development of the healthcare providers, mainly the nursing staff, for building their competency to very confidently and with great conviction speak to the women who are pregnant and who have to undergo the test for checking out on their status of diabetes in pregnancy, and if they are found to have high blood sugars, that is hyperglycemia in pregnancy, these nurses, after this short weekend certification training course, will be empowered to counsel them about what can happen to these women when they have a high sugar. And as you all know, 80% of these can be managed with what is called the MNT, or medical nutritional therapy, whereby if the staff cadre of nurses who are empowered to speak with conviction, to communicate better with these patients, keep them motivated to follow a standard pattern of diet and exercise, we are sure that definitely the dream of 80% of those who are diagnosed with diabetes in pregnancy to be on good control with this counseling and motivation alone will become a reality. So in our vision 2022, we need to collaborate with as many organizations as possible and create a massive cadre of healthcare providers who will do this job of counseling, because we know that in India there are 30 million deliveries happening every year, which means that these 30 million women will need the test for diabetes in pregnancy twice in their pregnancy. 5 to 6 million of them will be found to have a high sugar. These will need further counseling for their nutrition and exercise, which means that we need to have at least 1 million healthcare providers in the form of good communicators, the nursing staff and the support staff who will take on this role of being the catalyst, being between the consultant and the patient themselves, to fulfill our vision of skilling India for a better and a healthier future. So this is for the very first time Artist has taken this initiative in collaboration with the BSOG, or the Bengaluru Society of ONG. This is the very first batch of 20 staff nurses who have come here to take this training, and further on we would be recruiting many more, and we do hope that our dream of creating this band of good healthcare ambassadors will multiply into hundreds and thousands and millions who are needed to nurture a healthy future, because we strongly believe that women's health is nation's wealth.
I am Dr. Rita Singh. I am an associate consultant with Dr. Hema Divakar at Divakars Speciality Hospital. I have recently been certified as a health and wellness coach from the California Institute of Integral Studies. During our treatment of diabetes in pregnancy, we find there is a great role for motivation of patients, particularly so when we ask them to follow a certain diet and exercise programs. There are a lot of social constraints as well as anxiety and apprehensions associated. So this motivation plays a very important role in making them understand how to take care of their own health through the diet and the exercise, and thereby take care of their pregnancy and the sugars during the pregnancy. So we want to train the nurses to be able to talk to the patients correctly, to motivate them correctly, to make them understand how it is important to take charge of their own health by their diet and exercise, so that the sugars are well monitored during pregnancy and they don't have the anxieties related to it. This will help them take care of their pregnancy well and help control the sugars correctly. So we are going to train these nurses on the motivation and wellness for the patients, so that they can talk to them correctly, make them understand the problem and able to deal with the problems by themselves confidently.
I am Dr. Purni Narayanan, Associate Consultant with Dr. Hema Divakar at Divakars Speciality Hospital. For the first time, we have undertaken training of nurses to certify them in competency dealing with patients in terms of diabetes in pregnancy. Patient load, the amount of diabetes being diagnosed in pregnancy is increasing. We need the nurses to be empowered so that they can also start educating the patients about what the problem deals with, so that they can start curing themselves, treating themselves, dealing with the diet and exercise that is required to keep the sugars under control throughout the pregnancy. We are teaching the nurses so that they can explain to the patient what is the testing that is done, how it is done, when it has to be done. Sometimes patients get to spend more time with the nurses. They are more reachable, so that the nurses can assure them that it is in their hands for them to control the sugars during the pregnancy, allay their anxieties, also tell them about the complications that can happen if the sugars are not under control. It helps the doctors a lot in dealing with the patients as well.
Hello, welcome to this course on building your competency so that you are able to speak very confidently and with conviction to all pregnant women who need the testing and care for diabetes in pregnancy. So just can I have your name?
I am Biman Vishwas from Tripura.
And yourself?
I'm Roshni Gaidi from Nepal.
Oh, this is Nepal and Tripura connections at Divakars Hospital, a course hosted by artists and the Bengaluru Society of Obstetrics and Gynecology. So let's find out from the participants about why they came here, what is the value that they got out of this course, etc. So Tripura goes first.
Before I came here, I just know about the diabetes mellitus, what it is effect on the normal peoples who are getting this. But after coming here, I know about gestational diabetes mellitus.
Excellent.
What affects the baby and what affects the mother. And I know how to counsel the mother who is having diabetes mellitus in his gestational age. Now I can counsel about the nutritional diets, medical nutritional therapies and exercise, what we can give to the diabetes mellitus patient of pregnancies.
Excellent. So you have learned a
Yes,
lot,
ma'am.
because you didn't even know that pregnant women can be affected with high blood sugars, right? So
Now
excellent.
I can understand what is the universal test for recognizing the diabetes mellitus in pregnancy.
Very good. I think I'm extremely pleased with the inputs that I'm getting from one of our participants from Tripura, because it's a lot of insights from nothing almost to everything that this candidate has learned. So congratulations
Yes, ma'am.
for having successfully completed the course. Roshni.
Yeah, it is a very great program for me. For myself, this program has given me a confidence to explain about diabetes mellitus. Previously, I know about diabetes mellitus, but I don't have that confidence to deal with patient about how to do the test and even counseling. I think that's a part of doctor, but even being a nurse, I think I'm now able to
Very good.
explain, counsel the patient about their diets and whatever exercise they have to do. I can explain them by myself. So I have improved my confidence.
Excellent. So how was the whole teaching program? It was like very theoretical, or you were made to speak and you were made to do the role plays, and did the format of the way that we teach, did you find any value in that?
This is one of the best class, I must say, because there were that all the teachers explain it in a very easy way, like some were comfortable with Hindi, so they explain it in Hindi also, and the interaction was there between the teachers and the student. I don't think I missed any point whatever they
Excellent.
did. So it was very nice for me.
We have performed
And
role play
I-
also. So in this role play we can rehearsal our water sessions, all the programs we have rehearsed and we understand better.
And we as the faculty of this course really appreciate the very active participation and involvement of all the participants. These are the two representatives, a large number of them from Nepal, a significant number from Tripura, one from Kerala also, and the young minds which are getting prepared now to be more confident in the coming years, not only in India but also in the whole of South Asia. So these will be the front runners or the ambassadors for better health for the next generation, and I'm very delighted with your feedback, because it's not important only for us to go on and think we're doing a great job. It is when it comes from you, how well you're going to be actually telling things to the patient. That is the skills that we have transferred to each one of you, which you will be able to go and use it in real life. So thank you very much, not only for your participation, but for your involved participation. All the time more voices coming from this side, and the right answers coming in have made us really very proud of the young, healthy generation next, and we will always cherish the experience that we have had with this very lovely set of students. Thank you very much.
We also thank you, ma'am.
Thank
We
you.
also heartily thank all the authorities who have conducted this program for us. We have learned so many things from this seminar and we would like to heartily thank to all the authorities.
Thank you very much, and congratulations for now being the first ever certified frontline healthcare providers for counseling and supporting the management inclusive of testing, medical nutritional therapy, diet, exercises, motivation, wellness, long-term follow-up, taking care of the mom and the baby. Oh, there is a lot that you have learned, and there's a lot that you can do with these great learnings, because now you qualify as a certified counselor in supporting the management of diabetes in pregnancy. Thank you very much.
Thank you.